accordingly. In closing, I just want to remind all of you the imperative of continuing to maintain your vigilance in terms of the actions you can take to spread and mitigate, not wildfires in this case, but of COVID-19. That 2.6% positivity rate is encouraging. Number of deaths is beginning to decline, which is also encouraging. Still, though, stubbornly at about 60 and 69 deaths. That's the 7 and 14-day average total number of deaths. It's just a reminder, sober reminder, the average of 69 deaths a day still because of COVID-19. Don't be misled that this disease is any less deadly. Quite the contrary. It's as much or more deadly than it's ever been in the context of those that are high risk. And despite so much of the improvements we've seen in therapeutics and how we've managed the disease, again, people are still losing their lives. What you can do, as always, is practice that physical distancing, that social distancing, wear those masks, wash your hands. It's flu season. Wash your hands just on the natural will mitigate the spread of the flu as well and minimize mixing to the extent possible. Tomorrow, just briefly, and I'll turn it over to questions, Dr. Galley will be updating people on a different type of mask wearing, and that's the Halloween guidelines that we'll be putting out tomorrow. Dr. Galley will also be updating on some other guidelines, including the guidelines we put out on Friday related to minimizing mixing and cohorting friends, family, or outside of your household. Those updates have been made this week. Just to preview, we'll be visiting with some of the larger theme parks, continuing those conversations back and forth. We continue in good faith to try to work to get where I know everybody wants to go, and that's to get people back to work and also create more entertainment options. But we need to do so in a safe way. We need to do so with a health-first frame, and we are going to continue that hard work, and a lot of that work will be advanced even further later this week with some insight visits and some deeper collaboration.